Hi everyone, welcome to Center of Balance Life. I'm Sinanpua from Center of Balance, the acupuncturist. Now today our topic is about what is polycystic ovary symptoms, PCOS. So why are we talking about PCOS? Because we just finished up the infertility, and with infertility, we mentioned about we want to get into individual disease that's causing infertility. That's why we're here today to talk about polycystic ovary symptoms, right? So we need to dig deeper in every disease, every problem, each of them, how they actually causing infertility. Does it make sense to you? Now, if that is something that you want to know, you want to learn, or you want to get more experience and knowledge of it, please give me a thumbs up and say hello to me. Right? If you're a practitioner, we're gonna break down uh, uh, every little part, and it'll give you according to Chinese medicine or acupuncture, and what sort of herbal medicines or what sort of acupuncture treatment strategy that I normally would use according to the patient. Right? Then if you a patient, so you can find some interesting things in here that rather than just Western diagnosis of PCOS. I'll add on a lot of my own experience and what can you do at home, some acupressure point at home, or moxibustion, and diet, what sort of diet you should take to regulate your period again and to get reduce the polycystic ovaries symptoms, something like that, right? Let's have a look. Hello. Hi, happy day. Hi, Veronica. Good morning, Sinan. How is your wife and your child? Hope it's not too hard. And then I know how they feel. Thank you for your asking. I think times will help. It's getting longer. Of course, we all still feel sad about the kid. But yeah, it'll come all right. Thank you for your asking and caring. Thank you very much. Okay. Now let's talk about PCOS. Now, polycystic ovary symptom, PCOS, right, is a condition that affects woman hormones level, right? Women who suffer from PCOS, they actually produce higher than normal amounts of male hormone, right? First idea for you is the hormone. We talk about female hormone and male hormone. It doesn't mean that in female hormone only in female body you only get female hormone and no male hormone. Okay, you actually get both. It just the female hormone have much more level than the male hormone. The same as in male body, we're male. The male hormone is much more than female hormone. Does that make sense to you? Okay. Now, in PCOS case, the woman actually have more male hormone than female. The normal one should be female hormone more than male. So that's opposite. That's why it become abnormal. Does it make sense? All right. This is the first idea you need to get. And then once you have this idea, and become much more easier to understand the symptoms of it, because all symptoms were related to the idea that I just feed you just now. Okay. So think about it. Does men have period? No, we don't have period. So it means that with female hormone, it actually helps you general or regulating your period, menstruation. Okay. Now, if you suffer from PCOS, your male hormone increase, right? Then what does it affect you? It affects your menstruation. You may skip your period, or your period may get to 40 days, sometimes 50 days, or 60 days. Some patients just get once a year, once in 2 years. And you know what? You should get your period once every month, and that's normal. I think about if you get once a year, or once or twice a year, that's about 6 months or 12 months in between. When you get less period, menstruation, you skip your menstruation every month, right? That makes what? That makes it harder for you to get pregnant, whoever suffers from PCOS. Okay? So it's simple, right? You skip your period because of the hormone imbalance. Because you get more male hormone than female hormone. That's it. Okay? Now, think about that. What is male? What do we have? We have here. You see? We grow here and here on the face. And we even have here over here. It actually come up to the belly. Common in men, very common, and men get more here and here, right? Unless it's only probably in white men. For Asian people, we don't tend to get a lot here and here, right? For Indian and for European, we get more here and here, right? So when it comes to PCOS, so if you suffer from it, you get hair grow in your face, and the hair grow up to your belly button, right? That's the abnormal. That's the abnormal. That's because the male hormone causing the problem. Okay. Okay. Now, you also need to know one thing, that PCOS can contribute to long-term health problems like diabetes and heart disease. I'll tell you what, when it comes to treatment, PCOS patients normally take metformin, and metformin is actually prescribed for diabetes. If you don't have diabetes sometimes, but they'll give you metformin because it's to do with the insulins and the pancreas, right? So we talk about later on when it comes to treatment. Okay, I just mentioned that you have the idea of it, right? So in the Western area, when it comes to treatment, it actually gives them birth control pill and diabetes drugs. It can help. Well, I won't say fix the hormone imbalance. It can improve the symptoms. It can temporarily balance the hormone. But what? It is a synthetic hormone. It is the hormone that comes a birth control pill, and the hormone that is outside of the body. You're not producing yourself. You're not controlling yourself. You just get extra in. Yeah. And that won't help to fix it, fix the root of the issues. When you stop it, it happens again. And there are a lot of side effects from the pill. And I have patients, no doubt, that they went for IVF, they were fine, nothing at all, but after one course of IVF, and they found out after the drugs, or the hormone, and then ended up they suffer from PCOS. That happened. So, and I will tell you what, a lot of people have PCOS. Majority of them have the history of using birth control pill. So birth control pill is actually one of the cause of PCOS. Okay, we'll talk about it later on when it comes to what causes PCOS. Right. Now, today we mainly want to focus on what is PCOS, what is polycystic ovaries symptoms. Okay, I will just introduce what's going on with PCOS. Thank you, Veronica. Okay. So far so good. If it's so good, so far so good, please give me a thumbs up. Thank you very much. And if you're on YouTube, please say hello to me. I can see that some of you in YouTube, but I just don't know what your name is. Okay, so if you don't say hi to me, I can't see who you are. Okay, please type in something and or give me a thumbs up, then I know who you are. Or not just thumbs up. I couldn't see you either. Just say hi and something like that. Thank you very much. And introduce yourself. Where are you from? Something like that. Okay. Now let's keep going. So apparently a lot of women have PCOS but don't know it. There's in one study, up to 70% of women with PCOS hadn't been diagnosed. That's a lot, up to 70%, right? That you don't know that you have PCOS. Now, I want to let you know that a PCOS is about the symptoms, right? PCO and PCOS is two different things. Okay, PCOS mean that you have cysts in your ovaries, and how do you know? You have to get a scan. You can't just. There's no symptom. It may not be any symptom at all. Okay, now PCOS symptoms means you have more than two and more than two symptoms together. Then that's called PCOS. If some patients, they don't have PCOS, they only have PCO, but they still put down on you have PCOS. Okay, that is very different, right? Because I've seen patients who are very slim, who have regular period, monthly, and the skin, they have PCO, they don't have hair growth in the body, and everything's normal. And they couldn't get pregnant, and they get a skin, that PCO, and no other symptom that can tell that's related to PCOS. Okay, so in this case, we will say, well, you have polycystic ovary rather than polycystic ovary symptoms. So the diagnosis need to be clear. Okay. Because I've seen a few patients of mine who come and ask suffer from PCOS, and I ask, you don't have PCOS, you have PCO. I say, oh, okay. My doctor told me I have PCOS. I said, no, the diagnosis is different. Okay, so you should put that kind of head on patient, because PCO is much easier to treat. PCOS is much harder to treat. Okay, in my opinion. Okay, in my experience. Okay, but because the PCO can be quite normal in the much normal in the hormone. Okay, compared with PCOS. Okay. Right. Um, mm, so so PCOS affects a woman's ovaries, right? Now you need to we need to understand one thing is with the hormone, uh, there are a few hormones that is they are very important. One is estrogens and progesterone. Okay, um, where are they come from? They are all they're actually producing by the ovaries, right? Then both of them are actually the function of regulating the menstrual cycle. So your bleeding menstrual cycle is actually controlling uh, by the estrogen and progesterone. Okay, they both involved a lot. Okay, um, with the menstruation, what is day one? Day one is the day that you get period, bleeding. That's day one. Until the next bleeding day that start, and between that, that is a menstruation cycle we call. Okay, menstrual cycle. Um, that the normal one should be about 28 days. Okay, that is the normal. Um, um, the ovaries also produce a small amount of male hormones. Okay, it called androgens. Okay, this is that's what I mentioned about in female. You still produce male hormone, not just female hormone. Okay, and important to note that. Okay, so when the ovaries is actually producing eggs, right, and release the eggs, right. So each month, the ovary release an egg, and the eggs when it's mature eggs, it release in it go through the fallopian tube and then to meet with the sperm, and that we call ovulation. When it meet with the sperm and it become embryo, that's called fertilization, right? Okay, hopefully that makes sense to you. Right, and what happened in this case, PCOS, is uh, it couldn't release the egg properly, right? Now it's because there are few hormone involved in there. Okay, so the first hormone you probably heard a lot about is FSH. So what FSH is? Follicle stimulating hormone, right? So we know in your ovaries, it'll produce follicle. And what's follicle? And the follicle is it got an egg in the follicle, right? An egg in the follicle, and that egg is has it's not a mature, it is immature egg in the follicle. So it needs something to build it up, to help it. Who's going to help it? Hormone. What hormone? Follicle stimulating hormone. So follicle stimulating hormone is stimulate on the ovaries and provide the immature egg and follicle to grow, right? To grow bigger and bigger and bigger and bigger, right? To grow bigger and bigger and bigger. So it grows to certain amount of level. Then another FSH is try to help stimulate the follicle to grow. That's it. That is the job. But you need another hormone to when it's mature and become mature, and need another hormone to stimulate the follicle to release eggs. So there's two things, two different functions, right? Two different actions in here. One is stimulate the follicle to grow. The other one is stimulate that follicle to release the mature egg. And that one to stimulate it, to release the egg, to release the eggs is called LH, luteinizing hormone. Okay, so both of these, FSH and LH, are controlling ovulation. Make sense? Right. So FSH stimulates. We know FSH stimulates the ovary to produce follicle, right? So in PCOS we call polycystic, right? Which means that what does poly mean? Poly means a lot, many, right? Cystic is cysts, right? Means many cysts. So where are the cysts come from? The cyst is actually a sac that contains an egg, which is the follicle. We give it another term called sac. So the sac is actually follicle. Okay, there's no other things. It's just follicle. Follicle grow to a certain point, and it can't release the egg. It can be because the LH, not enough LH. Okay, then not stimulate the follicle to release, or it may be because of the FSH that hasn't been enough to grow the follicle to a certain amount to become mature egg. Does it make sense? So so it can be in PCOS, which means is FSH and LH level is low, and what's high? The male hormone is high. So those two hormones low, the male hormone is high. That's causing the imbalance, right? So now we know about polycystics. There's many cysts, right? Those cysts we call is a sac. It's actually a follicle. Okay. There can be many in ovaries, right? So that actually stop it to ovulate properly. There's too many and it's stuck in there. Right? But now it comes to PCOS. What does S mean? Symptom. Mean you have to have two or more than two symptoms to be able to say, well, you have PCOS, right? So what are the main symptoms? There are three. Okay. Number one, cysts in the ovaries. As I mentioned before, how do you know that? You need to take a scan. Yeah. You just can't just ask question and to get the answer. No. You have to have a scan. That's one. Second, high level of male hormone. And how do you know that? You have to have a blood test. Okay, here's the second. Third, irregular or skipped period, menstruation. Okay, so those are the main symptoms, three of them. Okay. But of course, we mentioned that polycystic ovary symptom, it will come extra here, right? There's another one, or acne, or put on weight. Those are acne, skin problem, and hair growth. Second thing, in face or in the tummy area, gain weight. So those are the symptoms of PCOS. Okay, I hope it's all clear for you. All right, let's keep going. Okay, let's talk about the sac again. The sac is the follicle. The sacs are actually the follicles, right? We talked about it already. So each one contains an immature egg. Okay, the eggs never mature enough to trigger ovulation. Right? Then there's another guess what? Right. So in Chinese medicine treatment and acupuncture, we can actually get the immature eggs to release egg, to get the cyst to release egg. And that's not just way before that. When I first learned for infertility treatment, so we keep an idea that we can't get this egg to release from the polycystic ovaries, but that was wrong. Okay, because this research said that, and now the fertility specialists, they actually, I talked to some of them, and they say that they believe that the polycystic ovaries, those immature egg in the cyst, they can actually one day, and when it's right time, it can release the egg again. So it's not. So it actually matched the Chinese medicine theory, right? So the patient, they come for PCOS. If you treat them and you find that they period regular, and they come period regular, and if they took another scan, not just 1 month, for a few months in a year or 2 years, and you find that polycystic, the cyst actually no longer in the ovaries, and we don't know what happened. And there are two ideas for this. One is actually absorbed. The other one is they actually release the egg successfully, so it absorbs itself. That makes sense. And now the fertility specialists, they recognize that as well, right? They have the idea of that as well. Okay, so the lack of ovulation, although the level of estrogens, progesterones, FSH, and LH, we know about that, and the estrogen and progesterone level are lower than usual. Okay, in PCOS, but again, the androgen, which is male hormone, level are higher than usual. Okay, that's it for today. I hope this all helped to get you understand what's going on. Tomorrow we're going to talk about what causes polycystic ovaries. Okay, then we're going to talk about what are the common symptoms of PCOS. Then following, and we're going to talk about how PCOS affects your body. Okay, now it can affect infertility. That's the main thing. It can affect some cancer, depression, or sleep apnea, all this thing. Okay, and we're going to talk about how PCOS is diagnosed, all this thing. Okay, and we're going to talk about pregnancy and PCOS and how do you treat it. In Western medicine, how do you treat it? That's one thing. And how do we treat it in acupuncture and Chinese medicine? And we're going to talk about what can you do at home for PCOS, okay? And what lifestyle change, like give you some lifestyle tips to treat PCOS. Okay, of course we will talk about, when it comes to treatment, we'll talk about medication as well. Okay, so stay awesome, and I love you all. This is what is PCOS. Okay, and thank you, Veronica, and lovely. Now I hope all this helped, and stay awesome, and I love you all. See you tomorrow. Bye bye.